Colorectal Cancer Awareness Month, let's talk about from diagnosis all the way through treatment and surveillance. So diagnosis, colorectal cancer is diagnosed by colonoscopy and taking a biopsy of the tumor. Once the biopsy is confirmed on pathology that it is in fact colorectal cancer, you then usually get sent to an oncologist, a medical oncologist, and a colorectal surgeon. From there, a series of tests are sent in order to stage the cancer. So we want to know if it's stage 1, 2, 3, or 4. And the tests that we send you for are usually a CAT scan of your chest, abdomen, and pelvis, as well as some blood work. Now, this is going to be for colon cancer. We'll talk about rectal cancer separately. Now, what the CAT scan is telling us is whether or not that tumor has spread to other organs, because colorectal cancer spreads generally to the liver and the lungs. If those CAT scans are clear and there's no sign of cancer in the lungs or the liver, the next step is usually surgery. Now, I'm going to talk about details of the surgery in a different video, but essentially the surgery is to remove the portion of the large intestine that harbors the cancer, as well as a rim of tissue on either side and the lymph nodes that drain that area of the large intestine. After the surgery is performed, you are discharged from the hospital and we wait for the pathology to come back, which is going to tell us exactly how thick that tumor is into the wall of the large intestine, and it's also going to tell us if any of the lymph nodes also harbor any cancer cells. Now, this is where you will get your pathologic stage. So if there is no cancer in the lymph nodes, you are a stage 1 or stage 2. If there is cancer in the lymph nodes, even if it's just one lymph node, you are technically stage 3. Stage 4 colorectal cancer is what is usually seen on those CAT scans ahead of time, and that usually means cancer cells have traveled outside of the region to other organs. We look at a few other things on the pathology report to let us know if this is a high-risk tumor or a low-risk tumor. If it is a stage 1 or 2 and is a low-risk tumor, a lot of times you do not need chemotherapy after surgery. If it is a high-risk stage 2 or stage 3, more than likely you will need chemotherapy. This is when the oncologist guides you through your chemotherapy. They pick a regimen that is targeted at the type of cancer that you have to kill any residual cancer cells that might be inside your body. After this, you generally go into what is called surveillance. This is where we closely monitor patients to make sure that there's no sign that the cancer has returned. Surveillance generally means that you will get additional CAT scans of your chest, abdomen, and pelvis. You will need a repeat colonoscopy a year after you had your surgery. And then there's some blood work and physical exams involved as well. Depending on the type of cancer, this whole process can usually take somewhere between 4 to 6 to 8 months from the time you are diagnosed to the time that you go into surveillance. If you are in the Houston area and you are looking for a colorectal surgeon, my office is in the Heights and I would be happy to see you. I pride myself on providing accessible, excellent surgical care, which means that when you call my office, you will never get a phone tree. When you come to my office, you will never pay for parking. While I truly hope you never need me for those services, I'm here if you do.